And welcome back to Good Morning Kenya. This is Health Tuesday. My name is Mike Migu, and today we are addressing a very important issue revolving around cleaning and dressing wounds. And in studio today, I'm joined by one Dr. Kennedy Omondi, who is an advanced wound specialist. Karibu sana to the program.
Thank you so much.
How are you doing?
I'm fine, thank you. Hoping you are as well.
I'm good.
Awesome.
Asante sana.
Karibu.
To start off, let's talk about wounds now before we even get to cleaning and dressing. Huyu ni mtu ameanguka na pikipiki. Amepata a very bad wound from this side of the leg. How does he approach cleaning that wound? Or whoever is cleaning that wound, how does he or she approach that? And also, I'd also want you to address what type of wound is that?
Okay.
Yes.
Thank you. Awesome question.
Yeah.
To begin with, we understand a wound is any physiological injury that compromises that normal integrity of the skin.
Yes.
So despite how small the compromise is, we'll call that one a wound. So a wound arising from an accident, let's say with a motorbike or whichever kind of an accident, that's a traumatic wound. It will immediately, it's an acute wound, but falling under trauma. We also call them degloving injury, depending on the nature of fall. Like ameanguka, a large area of skin has been avulsed from the skin, so we call it degloving injury. It's a traumatic wound. Most of the times, these wounds normally tend to bleed a lot because there is trauma on blood vessels. And the immediate management will be one, to stop the bleeding, and two, to prevent entry of bacteria and maybe those non-viable particles on the surface getting into the wound. So immediate care, okay, there's the body's response, we call it the hemostatic phase, to try and stop that bleeding. But at times, if the body is not capable of doing that on its own, then secondarily, we'll need to apply pressure on this bleeding portion so that we can be able to contain bleeding or help stop the bleeding.
Okay.
That's the immediate care.
The immediate care.
Yes.
Now, talk about more on the classification of wounds.
We classify wounds in around 4 segments. One, we have the trauma,
Yes.
or traumatic kind of wounds. And these ones also have got subcategories. Now, the likes of cuts, be it surgical or non-surgical, you have the elements of now laceration, friction, animal bites, gunshot wounds, all those ones, because it's traumatic, there's something which penetrates or forces the tissues to rupture the skin to open up. So we call it that is traumatic kind of wounds. Then under that one we have, okay, now apart, that's the first category. The second category classification, you have burns. Burns, you may have burns from hot liquids, hot gases, hot contacts. We have chemical burns, you have radiation burns, burns from friction. You've had like those athletes, they fall on, they have like a friction burn or grass burn, commonly called grass burns. Even negative thermal effects, for instance, you're subjected to extreme low temperatures for a prolonged period of time. Also, that one is a kind of burn. Then the other category is normally caused by a predisposing comorbid. For instance, an underlying condition. You've heard of those under, let's say, endocrine conditions like diabetic foot ulcers. There are those also under a category called this lower leg ulcers because of vascular conditions like venous ulcers, arterial ulcers. Those ones also is a subcategory. Those are predisposing comorbids. And then the other category is normally from pressure, like you exert a lot of pressure. Commonly, people know them as pressure ulcers. In facilities, you'll hear people talking about a patient has a bed sore or something because of that prolonged period of time on a surface. So there's the bony prominence and the surface creating a lot of pressure in between, and we lose some tissues.
Yes. Yes. Now, I would also want to hear your views on wound sterility. What is wound sterility?
Wound sterility, now this one falls under what you normally call infection prevention and management.
Okay.
You find that most times there is that normal flora, we call them normal bacteria on the skin. They don't cause any harm on a normal skin. But then it gets to a point, let's say if there's a break on the skin and they find entry into the body, that is when we get concerned, because at times the body is not capable of fighting them off. Yes. So when you're talking about wound sterility, this is creating an ideal environment, bacteria-free, or there is no entry of microorganisms into the wound. Yes. And that's everything we'll be talking about sterility. So it is a wide scope involving how you clean the wound, how you prepare the environment, the kind of material that you're putting on top, so that the entire goal is to prevent entry of bacteria into the wound, from whichever surfaces.
Yes. Now, before we get to cleaning, of course, you do not just start cleaning a wound right away. What are the assessment procedures can one take, especially if you're taking care of a wound at home? How does one assess a wound before cleaning?
Before cleaning?
Yes.
Currently, the current management, we normally want, despite the size of the wound, at least if possible, I know we normally used to, you having a small cut from a knife, you're cutting your vegetables, a small slice, you've cut your skin. The critical options you check, how to assess, is the bleeding continuous? One, if bleeding continuous, it means probably you've damaged or you've cut a main vessel. So for that instance, you just need to go to a facility. The surface area that is exposed. If it's a wide surface area, also means like measures has to be taken so that you can be able to prevent entry of bacteria. Consider the element of pain as well. There are some that do not, the pain is just excruciating, maybe the pain is persistent, does not respond to normal household painkillers, as in now for such ones as well, you need to go to the facility. I know there are those small lacerations. In home setup, even we recommend even cleaning with normal tap water. Normal tap water is safe. Just irrigate and then you make sure it is covered. Do not leave wounds open. Make sure it is covered, just to prevent entry of bacteria. Wounds heal best when covered. Yes. When it's coming to an ideal setup, like a patient has come to a facility, that's when we employ what we call principles of wound care. Appropriate history taking, you need, before you even manage the wound, you need to know more about the wound and more about the patient. Because there are those factors, patient factors or wound factors, that can make the wound turn from acute to chronic. Acute wounds are those that are progressing positively to heal. Yes. But chronic wounds tend to misbehave and it's normally stuck in a particular phase. We call it the inflammatory phase, whereby it tends to prolong. Healing is stagnant. So principles of wound management, when you're taking the history, age is a factor. Get to know the immunization history. That's where you get to know was tetanus toxin administered. Get to know history of maybe allergies to medications. Get to know history, even the lifestyle of the patient. Maybe this wound is not healing because this patient is constantly exposed to bacteria, even despite cleaning. Lifestyle also things like smoking, history of alcohol consumption, such kind of history. History of underlying condition. Is the patient diabetic or hypertensive? Because those factors may contribute to stagnation of wound healing. After that is when you normally go to now assessing the wound. And this is another whole process. Yes. What is the wound status? What are the kind of tissues which are on the wound? Does it appear infected? Signs of infection, you check for those ones. The tissue type, moisture balance, then how are the edges? How is the peri-wound skin? Peri-wound skin is that area surrounding the wound. Also check on those factors. Then after that is when now you implement the goals from your assessment, now you come up with a strategy on how you're going to proceed on to manage the kind of materials you're going to use. You'll be talking about how frequently will you be doing the dressing changes, cost implication, both to the hospital and to the patient. I know that's normally also a big factor.
Let's say I've gotten a wound. How long does it take for it to be infected?
That will normally, what matters is the body's response or the immune response. Depending, some level you find that the body will be able to fight off the bacteria. We don't need to intervene. The body can be able to do that.
Yes.
But there are those instances whereby the bacteria can be able to initiate an immune response whereby it's overpowering, let me call it, it's overpowering the body's capability to fight it back.
Yes.
That's when you say the wound is infected. It might be immediate, it might take even years. I've seen a patient who has had wounds for several years, and the wound is not infected, but there are other factors that are making it not to heal. So you can't say this specific time span. It just depends on the body's immune response.
Yes.
If it's overpowered, then the wound gets infected. Yes.
So at home, there are those who administer first aid. Now, let's say in case of a burn, mtoto ameanguka kwa maji moto, how do you deal with such a case of a burn as opposed to when you are dealing with, let's say, a cut? How different do you address a burn and from a cut?
From a cut.
Yes.
Burns is an interesting area in that unlike cuts, you see when you're talking about a cut, there's that physical compromise, something which has separated the integrity of skin. Yeah. But talking about a burn, those cells are still there, but they have been denatured, as in they have been, the heat has compromised the status of the cell. So the cell is still there but cannot be able to function normally because of the heat. So managing it is a little bit different when you're talking about a cut. So one, immediate burn, try to remove the causant. To mean, in this case, there's heat. So cool the wound, try to cool the area. That is one. Do not break blisters. That's it's normally a good point to take. Do not break blisters from home, because the moment you break the blister, then you're exposing the actual wound to bacteria. Depending on the size, if there are those small, or maybe an instance whereby the blister is already broken, then I'll really recommend this patient to, or this child to be taken to a facility. Yes. We also normally check at, we look at the surface area of the burn. Using the size of the child, I know that in an advanced setup, they normally a rule that we normally check for, the percentage. For children at any age, take them to hospital.
Yes. On that note, we're going to take a short break.
Okay.
And we'll continue on that point. We're taking a short break. We'll be right back. Welcome back to Health Tuesday, and the conversation is centering around cleaning and dressing wounds. Daktari, before we went on a break, you were talking about how to address a burn differently from a cut. Yes.
Okay, awesome. We've just discussed that burns, the tissues are, the cells have been denatured, to mean they may not be able to replicate or regenerate normally in comparison to a cut because of the heat. Okay. So in an advanced setup, depending on the size of the wound, we normally say early excision and grafting or putting a flap. That's in a hospital setup, whereby you convert this burn into a cut so that it will be able to heal quicker. Remember, the cells in burns, they cannot be able to replicate because of their nature. The heat has denatured in a complex way the protein structure. So normal wound healing cannot happen because the cell is still there, but it's non-functional because of the heat. But now when you convert this burn into a cut, whereby you just slice off that portion that is burnt, and then now you convert it to an acute wound, so you can consider doing a graft or a flap. It heals quicker.
Yes.
Other options, depending on the depth, there are advanced dressing materials that can be used, like in grade 1 or grade 2 kind of burns. Those ones respond quicker. So we have a lot of advanced dressing materials which can be able to help regenerate the skin back.
We'll come to the dressing materials, and I'm just thinking about a person who, let's say, has gotten a burn, but has no access or no faster way of accessing medical attention. How does the person now addressing, or the person who is taking care of him or her, how do they address cleaning this wound, taking care of it, and ensuring it does not fester and is on the right path to healing?
Burns, we've said it's an interesting area. One, we said, we talked about blisters. Do not break blisters. And how to manage these blisters if they are there, ensure they have optimum moisture. So we normally apply water-based moisturizers on them so that they remain soft and not possible. The skin can be able to be flexible enough not to break. In an instance whereby it breaks, yes, we have available materials. They're readily available in facilities.
Yes, yes.
Not really the best choice, but they're capable of ensuring the burn remains optimum moisture, plus they provide at least basic antimicrobial cover.
Yes.
This is available in all pharmacies at no prescription. But we do not recommend self-care when it's coming to burns. Because they tend to take a little bit longer. Unless those small size, there's a blister, the blister can at times, most of the times, can be able to resolve back. The body can be able to absorb it back, and you find that the skin integrity gets to normal. But in an instance where there is a persistent blister, or maybe at risk of even breaking, do not have it like a self-care, just have it taken care of from the facility. I would recommend those actions.
Absolutely. Now, there is the idea of people. I've seen cases where people use hydrogen peroxide or alcohol to take care of their wounds, especially cleaning the wound. But hydrogen peroxide and alcohol are not the top of recommendation. Why is that?
To begin with, remember a good percentage of the body is water. I'm very sure we all know of that one.
Yes.
So anything where there is some salt, we normally call it sodium chloride in the body as well. So there's a recommended level of that. That is one. So anything that is going to alter the concentration of that means there is some impact on the cell. So cellular regeneration becomes poor, and wounds tend not to heal. Hydrogen peroxide is toxic on exposed structures, like even those young growing cells. I know people normally see you put hydrogen peroxide, the way it forms, you say, now this is working.
Exactly.
This is cleaning the wound.
Yes.
You're actually causing more harm than good. You're damaging those granulating tissues, the tissue that is meant to close this wound. It's burning, actually. There is no recommendation for applying hydrogen peroxide. It's an industrial chemical. Leave it for the industries and machine.
Yes.
Use it for cleaning surfaces, not for cleaning wounds. And the same is alcohol. I know it has some, we call it antimicrobial properties. We've used it to clean surfaces, to disinfect areas. They are toxic when it's coming to these growing tissues. We call them granulation tissues. Do not, if I could be able to talk in red,
yes,
do not apply such on wounds.
Now, I'd also want to know, why is alcohol then used as a sterilizer?
It is bactericidal on surfaces. There is no recommended constitution or concentration for it on the wounds. So we cannot be able to say alcohol is safe to sterilize or we can use it on intact skin. Let's say you want to give an injection and so is most of other preparations. You use them for skin preparations prior to a procedure, prior to a prick. Disinfect surfaces. You've seen patient before you give an injection, it's an alcohol swab. You swab the skin before you give an injection.
Yes.
That is okay. But once there's that break of integrity, we do not recommend.
Yes.
Yes.
Now, let's talk about chronic wounds. How is the cleaning? Are there special considerations when it comes to cleaning and dressing these wounds? What are the things that a person needs to look out, and how different is it from when you're dealing with a normal wound?
Chronic wound, okay, that's a categorization. So we normally have two. We have an acute wound and a chronic wound. Acute wound is one which is progressively healing. There's something normally called the phases of wound healing. They are continuous without any break.
Yes.
But when talking about a chronic wound, it means there is stagnation in one of the phases. This phase is normally the inflammatory phase. So the wound is stagnant there. So some of the factors that will make it stagnant, one is infection, two is presence of non-viable tissue with these dead tissues. Remember, good tissues cannot grow on top of bad tissues. We have now other elements like underlying conditions, for instance, glycemic controls when coming to diabetic patients. There is many other re-injury. A lot of stuff can make this wound, this chronic wound, not to heal. So the special consideration normally falls down on, when you remember when you talk about wound assessment, we normally call it wound bed preparation, whereby you identify and remove the barriers of healing. So this wound is not healing. Now you get to know the reasons why is this wound not healing. So you'll be just identifying and removing these factors. If it's infection, now this is where the special consideration comes. What kind of materials do you use to manage infection? If there's an element of moisture balance, there is either too much moisture or there is less moisture in the wound. There are several also advanced materials that you use to take care of the moisture to balance, to get optimum moisture levels. If it's an element of the edges, remember at times some wounds tends to take long until the edges starts carving. How do you address those factors? So those are the special considerations, just to identify what is making this wound not to heal and remove them. Yes. The goal is normally to make chronic wounds acute, so that they can continue to heal.
Let's talk about dressing the wound now. How does one choose the right dressing material for the wound? We have seen cases where some people do not really go for medical attention, but they use what is available to them. But what considerations? How does one choose the right dressing material?
It also goes back to the assessment. One, remember, like many other wound conditions, not wound, like many other medical conditions. Talk about someone got a headache, for instance. You cannot give medications to manage like maybe stomachache to manage headache. Same thing, even the wound got different indications. The materials that you use has got different indication. There is a material to manage moisture balance. There is a material to manage infection. So when doing an assessment, you need to come up and categorically check. This is an infectious wound, or there is an infection. The kind of dressing material that we require must contain an antibiotic to manage infection. If the wound, there is no infection, there is maybe little moisture on the wound. And remember, wounds heal with that optimum moisture. Then you need a dressing material which is going to donate moisture on the wound so that there is optimum balance and the wound regenerates. If the wound is, for instance, the edges are not right, it means you need to intervene, remove those edges. The dressings which will help with that, or maybe some intervention like a surgical intervention to remove the edges and so forth. So that is how you come up with the right material. It's a forum that normally get we have to at times educate nurses and doctors so that they can be able to know how best to assess. In the market, there's 1,000,001 products, but how do you choose the right material? By a proper wound assessment, you can be able to come up with the right materials for managing these wounds.
Yes.
Yes.
Now, what if somebody dresses the wound, but now after some time, the wound and the dressing stick together?
They stick together.
How do you address
that?
So
that one normally comes in instances whereby there is poor choice of dressing.
Okay.
Remember, this wound constantly, when it gets a good environment, there are those cells that grow or regenerate.
Yeah.
So this happens when, let's say you've done a dressing, which is a little bit porous, and then tissues grow to a point that it gets inside the dressing material. Removing it will be a challenge. That is one.
Yeah.
Two, you find that maybe this wound has got little moisture, and then you put a super absorbent dressing on top. What happens? It absorbs the exudate or that fluid from the wound to a point that it completely sticks, as in it dries the wound completely. Yeah. That's another instance which can make this dressing to stick on the wound.
Yes.
In an ideal setup, removal just has to be slow. You moisten this dressing. At times, some normally even tend to end up in theater to remove because of that bleeding when you tear it apart, because tissues have grown inside the dressing. Some normally end up like bleeding a lot. Moisten the dressing and they're normally removed. It trickles down all the way back to assessment. If you assess the wound and put the right material, I know in some setups, in advanced setups, there are those what normally call wound contact layers, then an adhesive wound contact layer, so that you need to do something absorbent on top. You first put this on these wound contact layers. Most of the times they're of silicone origin, so prevents adhesion. Then now you put your material on top. That's in an advanced setup.
Yes.
But in a normal setup, do proper assessment, you can be able to get the right material. Then how frequently you'll be changing this one? If you know you have to put something which is super absorbent, you need then to change the wound frequently so that you don't allow it to stick. It's something which we discourage, because remember, the more frequent you expose wounds or you do the dressing changes, you're damaging tissues. Normally, you tend to leave the wound for the longest time possible. We're having materials which can even stay up to 7 days. You don't dress a wound for even 7 days. But the right material, right assessment, you get the right material for it.
So the right material, with the right material, you do not need to do dressing of the wound frequently.
Yes.
It's about choosing the right material.
Yes.
Now, when does one now decide, or what is the place of antibiotics in as much as managing the wounds is concerned? Yes.
Antimicrobial management, there are two ways in which you're going to introduce antibiotics to a patient. One, you're having local infection, to mean the infection is just localized on the wound. That means you put antimicrobial dressings. Then when you're having a systemic spread, or this infection is now getting into the system, it's beyond the wound. That is when you take either oral or IV antibiotics, plus the antimicrobial dressings. So when you're looking at now the signs of infection manifesting in this patient, that is what dictates if the patient will be able to take oral antibiotics, or maybe IV or injection antibiotics, or just dressings which contains antibiotics. So you need to split the two. You don't want to give this patient antibiotics all through. Patient takes, it will be unnecessary. If it's just localized infection, an antimicrobial dressing is enough. If it's getting systemic, that's when you introduce systemic antibiotics. Yeah.
Now, back to the type of wounds. So if there are type of wounds, it means there are types of dressings. Yes. Please talk about each type of dressing specific for which wound.
For which wound?
Yes.
That is extremely broad. The market is saturated with advanced, that's why we hear this, advanced wound specialists. The advancements because of science. There's a lot of research and analysis outside here. So we have, for instance, what we categorically call foam dressings. foam dressings, these are meant to absorb, exudate, that fluid coming from the wound. Some of these foam dressings, those which contains antibiotics, some don't. So for infectious wound, for infected wounds, use those ones with antibiotics. If it's plain, it just means just to absorb that fluid coming from the wound. We have advanced options like what we call the negative pressure wound therapy. This is a device which is normally connected on the patient to help remove maybe fluid accumulation, to help tissues stick together. We normally use a lot post, let's say, orthopedic surgeries, maybe post debridement, post skin grafts, just to ensure there is tissue cohesion and removing both the fluid and maybe infected, those infected fluids from the wound, bacteria, with everything normally comes out. We have therapies like we've heard of hyperbaric oxygen therapy, or maybe the transcutaneous oxygen administration, whereby you suspect maybe there is limited or less tissue oxygen. The concentration of oxygen in the tissue is limited. Remember, oxygen is a crucial element when it's coming to wound healing. So if you suspect there is less tissue concentration of oxygen, then you have patients being put on hyperbaric chambers or transcutaneous administration of oxygen. You're having gels. There's some gels which is available in the market. These gels are either used to either moisten the wound or to debride. Normally in our language we say autolytic debride, just to remove the dead tissues. It helps to break down the dead tissues. So we use gels. We're having things like growth factor concentrate, or the platelet-rich plasma, whereby we call them, when talking about regenerative medicine, they're just those stubborn wounds. You've also heard of fat graft. This is a different intervention, helps with regeneration. So in such, you just take the patient's either fat tissues, they're normally concentrated, maybe run in a device, then they're injected back in the wound. They quicken the healing process. It's just jumpstart the wound again. So that this is an available technology as well. The dressings are many. You have like activated charcoal dressings, which still also contains antibiotics. Not really absorbent, but maybe for those smelly wounds, you need to take care of the odor. They come really handy. There are many. I cannot be able to exhaust the list. It's a long list. But trickles still down to assessment. You assess the wound, you can be able to get a whole list of materials according to your assessment, depending on the wound status.
Well, for somebody like me who grew up in the rural areas, I saw a time when our older parents used to, you get a cut. Unasikia amekwambia weka chumvi. Is it recommended?
Okay, in such a setup, yes. I can be able to say yes. In an ideal setup, no. Huh? But in those setup, remember, this salt concentration is going to dehydrate, even including the bacteria. Ile tulikuwa in school we used to, in biology, I think, or chemistry. Yes. Remember, we're talking about diffusion or osmosis, movement of molecules from one area to the other. Yes. So you put this salt concentration, the salt is of a higher concentration than that one in the bacteria or in the cells. So it's going to have some kind of a bacteriostatic effect, whereby it takes in the moisture from even the bacteria, from the surrounding tissues, and tends to dry it up.
So the idea was it will stop the bleeding.
Bleeding, not as per se, but okay, to some degree it worked. But okay, in that setup, it may be a deal, as those initial first aid before maybe something can be done.
Yes. Yes. Talk about symptoms of an infected wound. Yes.
This is really critical. Manifestation, let's say, like pain. That's normally one of the factors. We talk about erythema, or reddening of the tissues around the peri-wound skin, the immediate adjacent skin after the wound, peri-wound skin, erythema or redness. Yes. To some patients, they have either a lot of leakage, you call it a lot of exudate, which at times might turn purulent, or maybe I don't like using the term pus, but it's a common language. We call it purulent exudate. We have element of even skin, or the tissue changes color. It darkens in a way that it's not healthy. Healthy tissue is beefy red. We call it beefy red. When it starts to darken, it means there's some element of infection as well. Exudate, we talked about increase in exudate level. Some get smelly.
Yeah.
And then to some, depending on which bacteria are present, they change color. There's a common bacteria, it's called Pseudomonas. Normally it turns to, makes the dressing material and they won't start turning green. Maybe you've seen such instances because of presence of a particular bacteria.
So, especially, you've mentioned an instance where a wound becomes smelly. Does it point back to the type of dressing that one used, or even maybe the solution they used to clean the wound?
There's a lot of markers that can make a wound smell. One to include even the duration of dressing. How long has this patient had this dressing on? At times, maybe even you'll get even maybe the wound is not smelling, but that fluid has been sitting on the dressing for a long time, so it smells. Then dead tissues, presence of dead tissues in the wound can make the wound also to smell.
Yes.
Yes.
We have established that alcohol and hydrogen peroxide are not recommended.
Are not recommended, yes.
As far as cleaning the wound is concerned. Now we have water. Are there other solutions that one can use, especially if you're taking care of a wound at home? Are there solutions recommended solutions that one can use to clean
the wound? We've said tap water is safe. That is one in a home setup. If not available, just take the normal water, boil it, then you can. That's in a home setup. In a semi-advanced setup, there's availability of we call it normal saline solution. This is what normally people are infused with. It has got normal concentration of salt as that one in the body. That it is cheap and readily available. That one is recommended as well. Actually, it's the most recommended solution. Even in advanced setup, that is what we use for cleaning wounds. When in extreme advanced setups, we have already reconstituted chlorhexidine solutions. Chlorhexidine is also an antiseptic. It has some antibacterial effect. But still, even after using it, you have to irrigate the wound and flush it off, because those components are still not extremely safe on the tissues inside. Okay. So even after using those ones, they have to be irrigated with normal saline. So the perfect recommended solution is normally this normal saline. It is the best.
Now, when is it right now to decide, I'm going to the hospital because of this wound? When does one decide it's time to go to the hospital? Because there are times you take care of a wound at home and it heals, but at times you don't. When do you decide it's time now to go see a doctor? What factors do you consider now?
Okay, this is what I can advise the public when it comes to that. Don't wait for a wound to be a hindrance or to affect, like, or don't wait for it not to show signs like it's not healing, then go to a facility. Remember the importance of, or maybe you want to prevent debilitating conditions like tetanus. You have a cut, you don't know what cut you, maybe you even know what cut you, but the environment is really not ideal. Go to a facility, get this tetanus injection. The shots are going to really help. You can receive even advice like this wound is okay, you can manage it on your own. From get those confirmations from a medical practitioner, like this one you can be able to manage from home. This one, please be coming for dressing changes at the facility. But don't make that decision on your own. Remember, presence of bacteria gain entry, then you're going to have a long time healing that wound. So I wouldn't recommend wounds of any size, any caliber, don't overlook them. They might be the reason why you're losing a leg or you're losing an arm, because just overlook, like this is too tiny or something. Don't overlook. Get that confirmation from a medical practitioner, like this one, you'll be able to take care of it from home. Or use ABCD to help you heal this particular kind of a wound, not your own decision.
You've mentioned tetanus, and not many people really know what is it and how it relates to injuries. Maybe talk a little bit about the tetanus immunization with respect to injuries or wounds.
This is normally a very limiting status that might arise when the tetanus itself gain entry into the... So the portal of entry is through the wound. It is something which is common, like all over, in several surfaces, that is, infected surfaces. So it will gain entry through a wound. Not necessarily like if you're cut even with something which is rusty that will develop tetanus, not necessarily. But by the fact that you can't be certain that this is a surface which was contaminated with tetanus, that's why you normally go to get these injections. In itself, it's a condition which attacks mostly the muscular system. And it can really take people down. That normal muscular function is lost completely. Coordination is not there. Weakness, general weakness, and managing it is difficult. It's extremely difficult managing like tetanus. So just to prevent it, just get the shot.
So it's not necessarily that you have to get a cut or you have to be injured for you to get a tetanus?
No, there has to be like an injury, even burns. As long as remember we talked about a wound is a compromise in skin integrity. So as long as there's a portal of entry, it means you need to take care of your inner environment. And one of the way to do that is to get the tetanus injection.
Talk about how, are there special considerations when it comes to dressing and cleaning wounds in older population as opposed to children?
To children?
Yes.
Yes. Remember, in old age, there is a tendency of slow healing. The healing process is slower in comparison to younger generation. The regeneration process, the cellular activity is a little bit slow. So these patients tend to heal extremely slowly. So the kind of option for dressing materials, the frequency also has to alter. You need to ensure you interfere less with this kind of wounds in older people. The more you interfere with them, like you're doing frequent dressing changes, the more you're damaging those slow healing cells. Remember, when the cellular regeneration becomes extremely slow. The skin is extremely thin in elderly age, to mean also the kind of materials that should be using should be one which is not adhering to the tissues, or just ensure this optimum moisture and comfort of these patients. The skin are brittle. You can easily break. So there is a lot when it's coming to the money. Infection also, they are really prone to infection. The immunity response is a little bit slower. You introduce antimicrobial dressing or prophylactic antimicrobial dressings to them earlier in comparison to even the younger generation. Yeah, because remember, even some of them have got a lot of underlying conditions. So care is normally critical when it comes to the elderly.
As we come to a close of this program, why is it important to take care of your wounds?
The complications are normally worse. Complication of wounds, that's something which most people normally don't look at. You see, like, this is small. Wounds can be fatal. Let's start by that one. Depending on the extent of infection and the entry of infection, how the body responds to it, they can be fatal. At times they can lead to even loss of limbs and loss of parts like toes, maybe even the arm, because necrotic or dead tissues, necrotic tissues doesn't tend to, some people talk about gangrene and everything. Those are possibility complications of
Yes.
wounds.
Yes.
So not taken care of well in the initial phases, it means there are complications attached to that.
Yes.
So it's important to prevent complications related to wound status.
Yes. Your parting shot.
I didn't see that coming. Remember, wounds comes in as a management of wounds is a multidisciplinary thing. You cannot also be able to look at wounds as an individual. You incorporate other medical practitioners.
Yes.
Early referral for those facilities not able to take care of wounds appropriately, early referral is part of treatment. And wounds heal best when covered.
Yes.
So ensure the right dressing has been put on the wound to make them
Yes.
heal quicker.
Thank you so much for making time for us.
Much welcome.
We have been talking to Dr. Kennedy Omondi, who is an advanced wound specialist. I hope you have learned a thing or two concerning dressing and cleaning of wounds. Now, this is where Good Morning Kenya puts a full stop. Until tomorrow morning, same time, same place. My name is Mike Megwe. Thank you for watching and keep watching KBC Channel 1.